Hello everyone. Today we are going to talk about pharmacist exam questions. So let's start our lecture for today. First question is, which of the following is a fifth generation cephalosporin? A. Cefuxetine, B. Cefazolin, C. Ceftaroline, D. Ceftriaxone. As you already know that cefuxetine is a second generation and cefazolin is first generation. Ceftriaxone is third generation. So we already have ceftaroline, which is the active against methicillin resistance, Staphylococcus aureus, MRSA, and gram-positive bacteria, and it's the fifth generation of cephalosporin. So the answer will be C, ceftaroline. Another question is talking about a case about one using two drugs of cancer, one with less side effects to choose. So, what is the type of the cost? A. Cost effectiveness. B. Cost minimization. C. Case study. D. Cohort study. The answer will be cost effectiveness. Which process does insulin work on or increase? A. Glycogenolysis. B. Glyconeogenesis. C. Glucogenesis. D. Ketogenesis. The answer will be B. Glyconeogenesis. Patient has hypertension and benign prostatic hyperplasia. Received lisinopril and brazosine, but still uncontrolled and he has side effects, orthostatic hypotension. So, do we add finasteride or stop brazosine, or finally discontinue brazosine and change it to alphazine? Brazosine is alpha blockers, which it may cause side effects after the first dose as orthostatic hypotension. However, alphazine is uroselective alpha blocker, which appears to cause less orthostatic hypotension than non-selective alpha blockers as brazosine. So we are going to choose C, discontinue brazosine and change it to alphazine. Best time to take simvastatin. A, at bedtime. B, at morning. C, afternoon. D, anytime. Simvastatin is taken once a day in the evening. That's because your body makes most of its cholesterol at night. So simvastatin works better at lowering cholesterol at night than in the morning. So the answer will be at bedtime. Xanthan drops is used for A. Glaucoma. B. Fungal infection. C. Bacterial infection. D. Viral infection. Xanthan is actually classified as an ophthalmic glaucoma agent and lowers pressure inside the eye by increasing the amount of fluid that drains from the eye. So the answer will be A. Glaucoma. What is the clozapin's test monitoring? A. Neutropenia. B. Liver functions. C. Kidney functions. D. Testing of vitamin B12 levels. Monitoring clozapine patients. Baseline blood test should check the white cell count. So the answer will be A. Neutropenia. Which of the following is the first line drug for Alzheimer's? A. Amantadine. D. Donepezil. C. Levodopa. D. Dopamine. Donepezil can be prescribed for people with early to mid stage of Alzheimer's disease. The latest guidelines recommend that these medicines should be continued in the later severe stages of the disease also. So the answer will be B. Donepezil. Case of a patient taking some drugs and he got hyperkalemia. Which one of these drugs causes that? A. Thiophanate. B. Spironolactone. C. Gentamicin. Spironolactone is a class of medication that called aldosterone receptor antagonists, and that can cause severe hyperkalemia. So the answer will be B. Spironolactone. Which of the following is parenteral direct thrombin inhibitor? A. Argatroban. B. Dabigatran. C. Heparin. D. Warfarin. The answer will be A. Argatroban because it's parenteral direct thrombin inhibitor. What is the adverse effect of fluoroquinolones? A. QT prolongation. B. Rash. C. Increased blood pressure. D. Constipation. As we already know that the adverse effect of fluoroquinolones will be a QT prolongation. Which of the following antiplatelet working by inhibition of adenosine diphosphate receptor? A. Aspirin. B. Abeximab. C. Clopidogrel. D. Streptokinase. Also, you know that the answer will be C. Clopidogrel. Thank you so much for attending the video. I hope that you like it. Please don't forget to subscribe, like, and share. See you soon.